Now I want to quickly talk about some two disease conditions that are linked. If not for being a medical student, there's even no point trying to know the differences between the two of them. But for being a medical student, you have to be so accurate with your judgment. So it's good you know the differences between a lot of things. So we're looking at the true Perthes disease and a Perthes-like disease. Okay, true Perthes disease. Some people call it Perthes. Okay, I don't know, but it's like that. So the true one is also known as a Legg-Calvé Perthes disease. So Perthes disease usually refers to a condition that resembles Legg-Calvé Perthes disease, okay, which is like a childhood stuff. Okay, so if you're now saying Perthes-like, it's like a disease that is looking like the Perthes stuff, but not classically like it. You understand? So let's have it. The true Perthes disease, which is also known as the Legg-Calvé Perthes disease, is here. So it's an idiopathic avascular necrosis of the femoral head, mostly in children that are around age 4 to 10. So the femur is not having blood supply adequately again, so the tissues there is dying, mainly the bone tissues. So pathology is because the blood supply to the femoral head is disrupted, so bone cells are now dying as a result of that. So femoral head will collapse. So later on the blood supply comes back, and remodeling. So there's a lot of hip pain, there's a lot of limb pain, there's a lot of limited range of motion, and sometimes you have referred knee pain. So causes evolves through stages over several years, and the outcome depends on when it started. Then also it also depends on when they discovered it. Okay, and they were able to get it back, or treat it. Okay, so that's what we got. So Perthes-like disease is just a term used when similar avascular necrosis of the femoral head occurs, but it's not classical like the childhood one. Do you understand? But there's problem in the femoral head anyway. So sometimes it's other secondary avascular necrosis from trauma, corticosteroid therapy, alcohol abuse, maybe due to sickle cell disease. Do you understand? So I usually used to see sickle cell patients having these issues. There's sometimes congenital or metabolic issues. There's sometimes even avascular necrosis in adults. You can see Perthes-like disease. So I think that's what we got, clarifying between the two.